Good morning. I'm Robin Strongin, and I'm here with Amy Dark today, and we're delighted to have another webinar on the role of the school nurse in vaccine uptake. And this is another one of our webinars in our Script Your Future programming. Script Your Future, for those of you who might be new to our campaign, is a national education campaign that is brought to you by National Consumers League. National Consumers League is a nonprofit based in DC. We've been around for 125 years. And a signature program of the healthcare work that we do is our Script Your Future program, which is designed to work with schools of pharmacy across the country and allied health professionals to help consumers understand the importance of medication adherence. Sticking to your therapeutic protocol that your health provider is recommending for you to stay as healthy as you can. An important element of that is vaccines. And we know as school years begin that for children entering school and young adults, vaccines are really important. They're a part of keeping kids healthy while they're learning. It's also important for the teachers and for all of the employees in a school setting. And we are so fortunate today to have Amy Dark with us here to help us understand the role of the school nurse as we talk about some of the vaccines that are particularly important for children and families. And we're looking at the K through 12 school-age children. Amy Dark has her master's in BA as an RN. She serves as a nursing education and practice specialist for the National Association of School Nurses. She's practiced school nursing for 16 years. She is a K through 12 health educator. And what's really exciting is she is about to become a doctor of nursing practice this summer, which is really extraordinary. And the more I learn about school nurses, the more it's really clear to me what a treasure school nurses are and have been for a really long time. Not everybody knows about the school nurse and the role that you guys play in the lives of children and family. And we're going to dive a little bit more deeply there. But I wonder if we go to the next slide, if we could lead off by you just telling us a little bit, Amy, before we get into the vaccine piece of it, what these days is the role of a school nurse? A little bit of background on that. Take it away, Amy.
Thank you so much for the warm welcome, Robin. I do appreciate it. And I'm delighted to be here today with the National Consumer League, speaking to a wide range of professionals, parents, families, and caregivers. Frequently, as I am promoting the role of the school nurse, I will ask folks, do you remember your school nurse? And it's funny because I have one of two answers. The first is, oh, yes, I remember Mrs. Jones, and I know exactly where her health office was, and I could walk there right now if I was in my old elementary,
I
middle, or
remember
high
my
school.
school nurse. Yeah, yeah.
Absolutely. Or other folks who would say, gee, I don't even know where the health office was. But more frequently, it is the former that people can really remember and identify with it. Uh, Nowadays, school nurses are caring for a wide range of health concerns. Children are increasingly coming into the school building with acute and chronic illnesses. We have children who are living with epilepsy, diabetes, spina bifida, and a number of other health conditions. So the school nurse's role is really that of assessment and caregiving and keeping up on those important professional skills so that we are ready and able to ensure that all children who come into the school building will be cared for so that they can be healthy, safe, and ready to learn while in school.
So as a new year, a new school year has started, there's sort of a range of vaccines that students are required to have. And if you could explain a little bit about how that works, because there's students who are entering school for the first time. There is we're right smack in the middle of flu season now, and there's a series of vaccines. So how does that whole apparatus come into play here with what you and your fellow school nurses, what is, how does that translate into uptake for vaccines?
Absolutely. One of the primary roles of the school nurse is ensuring that the student's health record is complete. And all 50 states have requirements, vaccine requirements for school entry. Um, and it's important that the school nurse be familiar with what those mandated vaccines are for all grade levels, pre-K or pre-kindergarten students through grade 12. The school nurse ensures that the health record is complete before the start of the school year, and that any students who do have vaccines that are outstanding, that we ensure that that family has a means and ability to have those vaccines completed, whether that be assisting with making an appointment at the healthcare provider's office, or many vaccines which can be received at the local pharmacy these days as well. But tying a student and family to a medical home in the community is essential, not just for their vaccine, but also for their overall health. We have the mandatory vaccines, and then we also have the optional vaccines, such as COVID-19 and influenza, which at this time of year are important for keeping the school buildings healthy as well.
Is it up to the school to determine on those that are not mandated? Is it a school-wide decision which vaccines they require for entry, or if it's not mandated, then it's just up to the individual family to make the decision?
So actually, the CDC, or the Centers for Disease Control and Prevention, have a slate of by age vaccines that are required. And then the state will also mandate for the schools and the districts the required vaccines. And then we know that there's also an optional vaccine, such as HPV or the human papillomavirus, which right now is mandated in only 3 states. However, we know that there is an opportunity for increased vaccine uptake. Another aspect of vaccine uptake for school entry is that of vaccine exemptions. States vary on their vaccine exemptions. Some states have all states have a medical exemption. So if a student has a medical reason as determined by a healthcare provider why they cannot receive a vaccine, then written documentation is required. However, other states also offer a religious or philosophical exemption, and some states offer a temporary exemption as well, meaning that the student comes into the school building, they are not current on their vaccines. However, they have an appointment with a healthcare provider, and that's when a temporary exemption may be issued.
Understood. I think if we move to the next slide, I know that for some families, there is a real struggle in terms of vaccine confidence, and there's a number of reasons why this has happened. Even before COVID, we know since COVID, there is a lot of mistrust and questioning of some of the guidelines that are coming out. And yet, in the schools, they're required, other than the exemptions you've been talking about. And I know that the school nurse, and I think we can even move to the next slide, is very plays a huge role in really working with families to build a trusted relationship, and then from there to talk about confidence in the vaccine programs. Can you speak a little bit to that?
Absolutely. Yes, you are correct, Robin. It is very important that that the student, family, and caregivers all receive consistent, confident, evidence-based messaging about vaccines. If a family has a question about a particular vaccine, or frankly, all of the vaccines, that is very understandable. There is a lot of information out there, and we know that there's a lot of mis and disinformation out
Yes.
there as well. We can hear something, or a family can hear something, perhaps from a neighbor or a relative, or even in the school parking lot or out on the soccer field. And we need folks to know where they can go for fact-based, evidence-based information. And the school nurse is the healthcare provider in the building. The school nurse is aligned in the facts and information that they are delivering to families in the same way as the healthcare provider. And if families are receiving that information, not only when they bring their child for their annual well visit, but if they have questions, feeling that they can approach the school nurse, then they're receiving the information in the same way. You know, Robin, the school nurse wears many hats, and we often work independently inside of the school building. In the Northeast, we know that there are excellent ratios of school nurses to students. Often there is one full-time school nurse per school. However, when we think about our rural, Midwestern, or
Ah,
Pacific Northwest states, it's not uncommon to have one nurse covering several schools at one time. But irregardless, that school nurse is the school leader in consistent, confident, and evidence-based approaches to these conversations and offering families resources. So when we're
I
thinking, yes.
go ahead, please. I didn't mean to interrupt you. Go.
Just that when we're thinking about the school nurse's role in vaccine promotion, the student is at the center. As you can see on the slide that we have on the screen right now, we have our student right in the middle. And the school nurse offers care coordination and leadership. We see the school nurse pictured off to the left, sort of with their arms enveloping that
Yes.
student and the school community in provision of that evidence-based health information.
And what happens with students who are homeschooled? Are they still able to visit with a school nurse if the need arises, or if they're not enrolled in a public school, then they can't? How does that work? It just occurred to me. I wonder.
Sure. So homeschooled students, yes, they still fall under the
Okay,
school auspices. So yes, the homeschooled student or family can absolutely call into the school nurse. They can email or receive information from us, anything that they need. Yes, definitely. If they are
great.
within our school community, then they are part of our school community. And we have the school nurse has strong relationships with our homeschooled community as well.
Oh, that's terrific. And what kind of relationships do you have with pharmacies in the community? Are there ever vaccine clinics in the school or not so much? Just how does that work? Because with Script Your Future, we're training the future pharmacists of this country. So curious to know about that relationship.
That's an excellent question. And on that, I will actually speak from personal experience
Okay.
as a practicing school nurse. So I practiced for 16 years, and the last 9 were in a rural area where I recognized the need. I'll give actually I can give 3 examples of where I was part of a school-based vaccine clinic. One specifically where I had a very strong and long-lasting relationship with our local pharmacy. Each September, I would recognize that when we think about the school staff and faculty, we're thinking about folks who work during the daytime. Oftentimes after school, they have other commitments. On weekends, of course, they do. These are folks that work 5 days a week, and it can be difficult for them to be able to get to either their healthcare provider's office or a community flu clinic or into the pharmacy. So I actually phoned our local pharmacy, again, in a rural area, and I asked to speak with the pharmacist directly, who was a tremendous asset and resource. And I asked them, I said, would you be willing to provide registration forms to me that I could have the staff and faculty complete ahead of time? If they have health insurance, they would be willing to bring their insurance card. And would you come to the school building during the staff and faculty lunch hour and use my health office to be sort of a mini influenza vaccine clinic? And they said yes. And it started a tremendous relationship
Oh,
where we
wow.
would set the date in the springtime. The staff and faculty knew when it would be the following September. I tried to have it within the first couple of weeks of school. The local pharmacist and the pharmacy technician would come to the school. They would be right there in my office. I had a private area where I was able to see students while this mini clinic was going
Oh, I
on.
see. Okay.
And frequently, in that 1 hour time period, the teachers, staff, and faculty knew well in advance when this was happening. They were able to complete that registration form ahead. They came with their ID and their insurance card, and within 50 minutes to 1 hour's time, often we had nearly 100% of staff and faculty who chose to avail themselves of the flu clinic. It was
Wow.
great, and what a tremendous community resource. I can't say enough about our local pharmacy.
That's amazing. And that's what we like to hear. And it's interesting, we're studying through Script Your Future some of the expanded and evolving role that pharmacists are playing as part of the health team, just like the school nurse. And I think that as we're looking to educate consumers how to
Yes.
be, advocates for their own health, having people who are day to day there without needing to make an appointment, a school nurse, a pharmacist in a brick and mortar pharmacy, it's another touch point for, if not the kids, then their parents and guardians and family members and even older siblings. But I think if we move to the next slide, and I know that we've covered a lot of the information on many of these, even the next slide would be good. There are a couple of tactics that, or I should say practices really is
Mhm.
probably the better word. When working with people who aren't medically trained or haven't been to nursing or pharmacy schools, sometimes it can be overwhelming and confusing. And as we spoke about some of the misinformation that is out there, people want to be reassured. There are a lot of vaccines we're asking families to have their children make sure to be protected. And part of that is those of us, myself included, of a certain age, we know how devastating these diseases are. And we don't see many of these polio and diphtheria and some of these really dreadful diseases that, thanks to these vaccines, are no longer front and center, smallpox and others. I still have my scar on my arm from when I
As
had.
do I.
Yeah. But what are some of the practices? I see them up on the slide here. If you could spend a moment sharing how you use these when you talk with families who maybe do come to you for help in figuring out whether or not it's the right thing for their child.
Absolutely. And let me say, first and foremost, it is expected and it is responsible as healthcare consumers to have questions. We do not just do something because we are told to do so, especially when it comes to something that is going to be coming into our bodies or
Right.
into the body of our child. That is completely normal and responsible. However, there are some ways that we can approach those questions that folks have. And these approaches are appropriate for not just the school nurse, but any healthcare provider who is, engaging with students, families, and caregivers. So, for example, if a parent or caregiver were to come into my health office and they might say to me, my son is due for the physician, pediatrician, or nurse practitioner or physician assistant said that my son Jimmy is now due for his measles, mumps, and rubella shot, or MMR, and
Mhm.
also varicella or chicken pox. And I'm concerned about that. Parent might say, years ago, when chicken pox would go around, my mother would bring me to a chicken pox
Yeah.
party, and everyone would, get chicken pox, and they'd be over it in 2 weeks. So why can't I do that? And that would be an opportunity to ask an open ended question for me to say, Mrs. Smith, tell me about your biggest concern. What is the one biggest concern that the family has? And they might say, a friend of mine's son received the vaccine and they had a bad reaction. I don't want that to happen for my child. So now you're really identifying what that
Mm.
single greatest concern is. The next is to avoid medical jargon. Varicella may not be known to students' families that really is what we know as chicken pox. So let's use everyday language that is understandable to folks who have not had medical training. Folks who are coming with questions do not want to be responded to by things that just language that is not familiar to them. So let's use everyday language. Let's show respect for decision making. It is very unlikely if a family comes to the healthcare provider with concerns that you are going to change their mind on the spot. That is
Mhm.
very unlikely. This is a marathon, not a sprint. So if they have concerns, ask permission to give more information. Say, what is your biggest concern? When you understand what it is, perhaps that their friend's child had a reaction, say, may I give you some more information? So verbally tell them, but also have some handouts or resources or information to hand to them. But first ask permission. Say, Mrs. Smith, may I give you some information about that? When they say yes, that opens the door to a conversation. If they say no, my mind is made up, I've made this decision, say, I respect you as your son's parent. Perhaps I will reach out to you in a couple of weeks and see if you would like to talk more then. Let them know that your door is always open and that you have respect for their decision and the respect for them as the parent. And
Sure.
that goes a long way.
Wow. Okay. If a parent chooses not to go forward with one of the mandated vaccines, is the child allowed to enter the school or no? Or it depends.
Sure. So that is a great question. And it really does depend. It depends on the vaccine. It depends on what the state regulations are, if there's a religious or philosophical or
I see.
temporary exemption. So it does. In some states, there is only a medical exemption. And it's important to remember that it is not the school nurse who has that ultimate authority
Sure.
of who would be excluded from school. It would then be for the school nurse to work with educational leadership, such as the building leader, the school principal, school superintendent, have that relationship where you're engaged in apprising them of, our state deadline for vaccine completion. This is an example, is October 15th. Right now it's October 1st, and we have 3 families remaining. And just having that conversation so that it is a consistent message that is going home to families, but ultimately it would be educational leadership who would have that final decision. If we could move to the next slide, please.
Sure.
Um, this is really very key when we're thinking about our families, our caregivers, and what is the number one decision when they're thinking about whether or not they should vaccinate their child. And as we've talked before, Robin, the strong recommendation of a healthcare provider is key. And getting back to if they are receiving the same consistent, confident information from the school nurse, from the local pharmacist if they have questions, and from that healthcare provider either at the community health center or their own private pediatrician or nurse practitioner or physician assistant's office, then they are understanding that this is the same information, evidence-based information. And if that can be coupled with a handout from either the American Academy of Pediatrics or the Centers for Disease Control and Prevention, then that's just another reinforcement of that information.
Sure. And I think that's in the next slide, actually. So if we can move to that slide and really following up on that with the materials, not all school nurses are bilingual. So
Right.
if English as a second language is a barrier to care, I assume there's translated services that could be brought in or materials in another language. Am I correct in that assumption typically?
Absolutely right, Robin. And that is such an important key here, right? That the school nurse, when we think about the school building and the students, staff, and faculty within that building, it really is a microcosm of the
Sure.
greater community. It's sort of like just a little like cookie cutter chunk of the larger community. And it is the responsibility of the school nurse to know their school community and to be able to adapt the resources that they have. CDC website has numerous resources in multiple languages that can be distributed, and some health offices, some school nurses are fortunate enough to have their own dedicated school health webpage.
Ah,
Oftentimes, it can be linked to the school landing page on the internet. And that's a great place where there can be links to vaccine requirements as well as resources in multiple languages. They can also link health centers or no cost or low cost vaccine services. And remembering that that strong recommendation is the number one reason why folks decide to vaccinate, well, as is folks, families, and caregivers feeling like they are being heard and the information being given to them is, as you said, in that linguistically and culturally appropriate manner. So, learning your school community is key.
great. And Sam, if you could advance our slides to the one that says the role of the school nurse in SLVs, because we covered the exemptions already, and so yes, this is the one. SN is school nurse, and
Yeah.
SLVS is school located vaccination clinics, and we've talked about the vaccine requirements for entry to school. We've talked about guidelines for vaccinating during flu season and respiratory illness season, which we're right smack in the middle, whether it's a variety of vaccines that are available for children as well as for teachers and other staff in the school system, really important. But there's another group of vaccines as kids get older. Um, and that is, and I know you're doing your doctoral work around HPV, and that is really going to be the subject of future webinars. But I just want to plant a seed for folks listening because the school nurse does have a really critical role, as you've talked about already, as a trusted partner to ask questions. These vaccines can be complicated for families to wrap their head around. It involves cancer, it involves being sexual, it does or it doesn't involve sexual activity. And it's understanding that, especially for young children. So I know that you know a lot about this. What would you say both to pharmacy students who are going to be answering questions and what they might be thinking about when it comes to that vaccine, and also to the families in the public school about how to approach, in particular, the HPV vaccine, which is just an incredible innovation in our arsenal, but a tricky one sometimes.
Yes.
Can be.
So the human papillomavirus, or HPV, is a virus that most everyone has been exposed to at some point in their life. And it's a small percentage of folks who are exposed that it can eventually develop into a cancer. There are 6 different types of cancers that can be developed from HPV. And the HPV vaccine is a way to prevent that. However, let's remember that, like any vaccine, vaccines are only effective if they have been received prior to exposure. For example, if you are diagnosed with the flu or influenza and you decide to get the flu shot the following week, well, that may prevent future cases of influenza that season, but not the one that you currently have. It will not help for that. So the HPV vaccine is now was first approved in 2006. So it's almost 20 years now.
Mhm.
And it is appropriate for girls and boys. And it may start as young as age 9. That is what is now advised by the CDC, the Start at 9 campaign, because we know that with any vaccine, the younger you are when you receive a vaccine, the more robust your immune response is. And
Mm.
if one receives the vaccine younger or earlier than age 15, then it is only 2 doses of the vaccine. If one receives the vaccine after age 15, then it is 3 doses. So, for a lot of families and caregivers, and certainly the student receiving it, if we're thinking about the option of receiving just 2 doses rather than 3, well, that's something that's very attractive for
Yeah.
folks. And at this time, there is no booster dose that is recommended at any point in one's life beyond either the 2 dose or the 3 dose regimen. And
Is
Robin,
the dosing the same for boys and girls, or is
it
there a
is.
difference?
That's
Okay.
correct. Yes, it is. It is just the age that delineates the 2 dose
I
versus the
see.
3. And if we think about how many individuals that we know that have been affected by all different types of cancer. The HPV vaccine just protects against 6 different types. But if we think about how many people we know who have been affected by cancer, the fact that we have access to a vaccine that can effectively prevent certain types of cancer, that's a tremendous public health opportunity that we have, and an opportunity that families have to protect their children in years way before they would ever be exposed potentially.
And where can families bring their children for the HPV? Is that something they get in the school? Is that something they get from their physician or pharmacy? Where can families go for that?
Sure, great question. There are multiple places that folks can go, depending on the state and area that they live in and accessibility of the vaccine. I am not aware of any shortages of the vaccine right now, which is fantastic. However, this can be offered at school located vaccine clinics. It may be offered at the healthcare provider's office, community health center offices, as well as many pharmacies.
Okay, wonderful. And let's move on to the next slide. And this is talking about partnerships that school nurses have. Can you speak a little bit to this?
Absolutely. So there are many partners that school nurses have in supporting school located vaccine clinics. There are resources as we continue on with the slides, clickable links that our pharmacists, our pharmacy students, or our school nurses may use if they want to get a school located vaccine clinic started. The first step that I would say is always start with your educational leadership within the school building and get their buy-in and explain to the building principal or the superintendent that by offering a vaccine clinic within the school building, it is a tremendous resource for the community. Maybe start with something manageable. Start with a flu clinic for just students, and then perhaps in future years expand it to families and caregivers so the whole family can come and receive the vaccine at the same time. It's another way to um, align what the school offerings are with the needs of the community. when we would have school located vaccine clinics in my community, not just the one I explained
Right.
previously for staff and families, staff and faculty, I'm sorry, but we also, the state would actually offer influenza clinics where we would have families, caregivers, and students sign up. The school nurses would all be there to offer support for some of our perhaps hesitant younger students. And it was just a great community atmosphere. Um, in January of 2021, the local emergency management agency actually coordinated the COVID-19 vaccine
Oh,
clinic,
wow. Okay.
and the school nurses were invited to come and be volunteer vaccinators. So I was actually able to sit alongside local pharmacists, the local EMTs, our local physicians, retired
Wow, the
nurses.
whole community came
It
together.
was the entire community. We would have as many as 800 people waiting
Oh my
outside the
God.
door when that vaccine clinic opened, and seeing former students, grandparents of current students,
Oh wow.
families coming together. It allowed for the school nurse and the other local healthcare providers and emergency responders to be seen in a very different light. We were all in this together.
Absolutely. Sam, if you could advance us to the next slide. I know we talked about we are really right smack in the middle of influenza season and seasonal respiratory stuff that's floating around. I know we've talked a bit about this, so I'm going to jump us to the next slide because you were kind enough, and I do want to say we are going to be posting all of these slides at scriptyourfuture.org on our website, the consumer resource page. But I did want to do a shout out to this particular slide because it has some extremely useful resources for anybody looking and listening to the webinar. So if there's anything you want to mention on this slide, Amy, to call our attention to, please do.
Absolutely. Thank you. And my apologies to our audience. I know that this looks a little bit busy here. However, these are all hyperlinks, and each one of these resources is available on the National Association of School Nurses website, and they are hyperlinked here. If a school nurse or a pharmacist were interested in learning more about setting up a school located vaccination clinic, there is a complete toolkit that was compiled by NASN along with the Association for Immunization Managers. There is a planning checklist. Recently, you will see the hyperlink in bright blue, focus on fall. That was a webinar that I co-presented with Dr. Michelle Fiscus. She is the medical director of the Association of Immunization Managers, and that was just recorded on October 2nd, so it is quite current. Folks can watch that. NASN also has a school located vaccination position statement, and that would be used by a school nurse if they were looking for some evidence-based justification to provide to their educational leadership of an understandable question by the principal or the superintendent might be, we are already so busy and we're in the business of educating students. Why are we now going to expand into offering vaccinations? That's a fair and understandable question.
Yeah.
So there's a lot of information available in the position statement, as well as the Vaccine Confidence Toolkit for school nurses and the School Located Vaccine Resource Library. So the National Association of School Nurses website is available to all school nurses. You
And
do
I'm
not
correct in saying it is nasn.org
org.
is
That's
the
correct.
website. Okay.
NASN.org. And you need not be a member of the organization to avail yourself of the resources. These are available to all school nurses. Nationwide, we have about 100,000 school nurses.
Oh
That's
my
a
gosh.
tremendous cadre of healthcare professionals in schools. And
Wow.
in our national association, we have a membership of just about 20,000 or about 20% of the total. But it's important to know these resources are available for everyone.
And on the next page, really important, you were kind enough to include your email if people have
Yes.
follow-up information. And again, as you can see there, nasn.org is the website for your National Association of School Nurses. And on the next slide, we have some of the references, which will also be very useful to our audience. And I do really see a lot of areas of intersection for the adherence program that we're doing with schools of pharmacy, because with these vaccine clinics, as you've mentioned, being able to work with pharmacists in the community and to lend a hand and vice versa, and sharing of references and materials, we will be front and center with your presentation today to make sure all the schools of pharmacy have this and have the links to all of the resources that you were generous enough to include in your presentation. And really, on behalf of all of us at NCL, National Consumers League, and our Script Your Future program, I cannot thank you enough for your time that you put into preparing for this and our many conversations, and now for today's webinar. And I really see this as the beginning of a long series of conversations and programs, because this is really tremendously helpful. Kids go to school, kids need to know that there's somebody they can go and speak to when they have questions, whether it's about vaccines or anything else that kids today are bombarded with. And kids are fragile. They're strong, they're resilient, but they're fragile. And it's hard for kids to go talk about things that are scary, or they don't have the words for it, or they need to find someone who won't judge them. And it's really tough. And it's just really great to know that the school nurse is a resource for these children, no matter how old they are, all the way through high school, where things can get even more complicated, as we well know. So I do want to take an opportunity to say thank you very, very much. And we will be putting the entire program on Script Your Future website and on our YouTube channel. And we'll send it back to you to share with whomever and with all the schools. And thank you again, Amy, for your time, your expertise, and all that you and your colleagues do on behalf of students. So thank you very much.
Well, thank you, Robin. I certainly appreciated the opportunity to come together today. The school nurse knows the ally and colleague that they have in the local pharmacy and the local pharmacist. It is not just about vaccines, but multiple other conversations that we will all often have with the dispensing pharmacist, and knowing that there is another resource that families and caregivers can ask questions of, and where they can avail themselves of these important vaccines is critical for the health and well-being of the entire community.
And with that, we will say goodbye until our next webinar. Thanks again.
Thank you.